Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. Today we're going to learn something about coronary stents. What is the sole purpose of coronary stents? Do the coronary stents prevent heart attack? Do they prevent heart disease? How does a coronary stent help patients with heart disease? So let's begin. Here is a picture of a heart showing the coronary arteries. When we talk about heart disease, we are basically talking about a plaque buildup inside the arteries that reduce the circulation to the region of the heart muscle beyond the blockage. When the blockage gets extremely tight, like 90-95%, the remaining 5 to 10% is caused by a blood clot, and that is shown in this diagram. And we have this plaque building like a mount inside an artery, and the remaining 5 to 10% of the blockage is caused by a blood clot that leads to a heart attack. In fact, when patients come with acute chest pain and they are having an acute heart attack, we take them to the cardiac catheterization lab and try to open up the artery with a balloon and place a stent. The question is, does the coronary stent prevent heart attacks? Okay, here's an example of how a coronary stent is placed. First, a guide wire is passed through a blocked artery. A balloon is inserted and placed at the region of the plaque and expanded. After that, another balloon catheter, which has a stent mounted on it, is placed at the region of the plaque, and this balloon is expanded. When this balloon is expanded, this wire mesh stent is expanded and it plasters to the arterial wall. After that, the balloon catheter and the guide wires are removed. So what does the coronary stent actually do? The coronary stent basically compresses the plaque, it expands the artery, reduces the blockage, improves the lumen inside the coronary artery, and improve the blood circulation. The first question is, does the coronary stent prevent heart attacks? In fact, coronary stents are routinely placed in patients with acute heart attacks who come with significant chest pain and who have electrocardiographic changes to suggest they have heart attack. So definitely coronary stents prevent heart attack by opening up the total blockage with the balloon, and later on by placing a coronary stent we make sure that the arterial walls don't collapse and a good circulation is re-established to prevent the heart damage from a heart attack. If the heart attack patient comes within like 90 minutes, if a heart attack patient arrives in the hospital in the early stages, and if a coronary stent can be placed within 90 minutes of the onset of symptoms, there is a very good chance that we can significantly decrease the amount of damage to the heart muscle from the heart attack. But I want you to understand that this plaque buildup is a continuous process which happens over 30-40 years. First, it starts off like a fatty streak, a fat buildup, and later on there is deposition of fibroblasts and white cells, calcium, and cholesterol. And eventually, when it gets to 95%, as I said, the remaining 5 to 10% is caused by a blood clot. More interestingly, to answer the second question, does the coronary stent prevent heart disease? Actually, coronary stents do not prevent heart disease, or I should say progression of heart disease. The blockage we see in an artery is not an isolated phenomenon. More often than not, the blockages occur at multiple locations and they progress with time. The only way to minimize the rate of progression of these plaques in other regions where the stent was not placed is to address the risk factors such as high blood pressure, diabetes, cholesterol, smoking. And when you take care of these major risk factors, the rate at which the arterial blockage progresses is decreased. We cannot totally eliminate, but nonetheless, the rate at which the artery blockages progresses is decreased. As a result, it improves circulation to the heart muscle. Number two, it also improves your exercise tolerance. That's a very important point. It also improves quality of life. And another important point I would like to bring to your attention is by placing a stent, we have a better chance of preserving the circulation through that artery. Because in the days when we did not have stent, when someone came with a heart attack, there was a very likely chance that within 3 months there was an increased incidence of a second heart attack. So by placing the stent and normalizing the lumen size, we can greatly reduce the chances of a second heart attack occurring in the same region. So in summary, coronary stents address the problem of a localized blockage in a coronary artery. They greatly improve the lumen size. They prevent the plaques from collapsing into the arterial wall. By increasing the circulation, they improve the exercise tolerance. They improve the quality of life by reducing the frequency of symptoms, and they also prevent any further heart attacks. But there is always a chance that a different kind of plaque formation can happen within a stent, but that is rare. And I have had patients who had stents for 10, 15 years without having any major subsequent cardiac events in the same region. In the next video, we're going to talk about life after a coronary stent. Well, ladies and gentlemen, you have been watching Triple N Media. I am Dr. Nik Nikam, and we just learned something about coronary stents. What is their exact role? Do they prevent heart attacks? Do they prevent heart disease? I hope this has been educational to you, and please do subscribe to our YouTube channel, and we also have a Facebook page which is Triple N Media, and please visit our Facebook page and like it, where we bring you the latest news, and we also keep you updated on our latest educational videos. If you would like to learn something about a particular topic in cardiology, please leave your comments below. And until next time, I am Dr. Nik Nikam for Triple N Media. Thank you so much.